Hey everyone, it's your name here. Today we're diving into a topic that's close to my heart. Early cancer detection. It's a serious subject, but knowledge is power, right? We're going to be talking about the warning signs your body might be sending you, the ones you should never ignore. I'll break down the signs and symptoms you need to be aware of, so you can be proactive about your health. This isn't about getting anxious, but about being informed and taking charge of your health. So let's get started. Have you ever stepped on the scale and noticed a significant drop in weight, even though you haven't been trying to lose any? While many people might be happy about this, it's crucial to pay attention to unexplained weight loss. When I say significant, I mean losing 5% or more of your body weight within 6 months to a year without any changes to your diet or exercise routine. This could be a sign that something is off balance within your body. Unexplained weight loss can be attributed to various factors like stress, thyroid issues, or even certain medications. But it's also one of the early signs of several types of cancer, including stomach, lung, and pancreatic cancer. If you notice this happening, it's not about jumping to conclusions, but about having a conversation with your doctor. Remember, early detection is key. We all experience fatigue from time to time. It's a natural response to physical exertion, stress, or lack of sleep. But what if the feeling of exhaustion lingers even after a good night's rest? This is what we call persistent fatigue, and it can be a sign of something more serious. If you find yourself constantly feeling drained and your energy levels just won't budge, despite getting enough sleep, it's essential to take note. Persistent fatigue can be a symptom of many health conditions, including anemia, thyroid disorders, and even depression. But it's also linked to certain cancers, such as leukemia and colon cancer. Cancer cells are like energy vampires. They multiply rapidly and consume a large portion of your body's energy stores, leaving you feeling constantly depleted. So, if you're experiencing persistent fatigue that lasts for more than 2 weeks and disrupts your daily life, please consult your doctor. Your skin is the largest organ in your body, and it's often a reflection of your overall health. That's why it's so important to pay attention to any unusual changes in your skin, as they can sometimes be early warning signs of cancer. We're talking about changes in the color or size of moles, the appearance of new growths, or sores that refuse to heal. One of the most crucial things to watch out for is skin cancer. It often manifests as changes in existing moles or the development of new, suspicious-looking spots. Remember the ABCDE rule for moles: asymmetry, border irregularity, color changes, diameter larger than a pencil eraser, and evolving in size, shape, or color. But skin changes can also be indicative of other types of cancer. For instance, a darkening of the skin around the neck, armpits, or groin area can sometimes signal a rare type of cancer called lymphoma. If you notice anything concerning, make an appointment with your doctor or dermatologist right away. Coughs and colds are common, especially during certain seasons. But what if a cough lingers for weeks or your voice sounds hoarse for no reason? These could be signs of something more serious, like cancer. Persistent coughs, especially with other symptoms, need a doctor's attention. Lung cancer can cause a persistent cough by irritating the airways. Hoarseness can indicate throat cancer if it lasts more than a few weeks. If symptoms persist, consult a medical professional. Let's talk about a topic that might feel a little awkward, but it's incredibly important: changes in your bowel or bladder habits. While these changes can be caused by a variety of factors, some of them can be warning signs of cancers like colorectal or bladder cancer. When it comes to bowel movements, keep an eye out for changes in frequency, consistency, or the presence of blood in your stool. If you experience constipation, diarrhea, or a change in the caliber of your stool that lasts for more than a few days, don't hesitate to see a doctor. Similarly, changes in urination can also be red flags. This includes having to urinate more frequently, experiencing pain or burning during urination, or noticing blood in your urine. These symptoms can be indicative of bladder cancer or other urinary tract issues. If you notice any persistent changes in your bowel or bladder habits, don't hesitate to reach out to your doctor. Our bodies have a remarkable way of communicating with us, and sometimes those messages come in the form of unusual bleeding or discharge. While not all bleeding is a cause for alarm, it's crucial to pay attention to any bleeding that occurs outside of your normal menstrual cycle or is otherwise unexplained. For instance, blood in your urine or stool is never normal and should always be checked out by a doctor. Similarly, vaginal bleeding after menopause or between periods can also be a red flag and should be evaluated by a gynecologist. By paying attention to your body's signals and seeking prompt medical attention when necessary, you're taking a proactive approach to your health. One of the most well-known warning signs of cancer is a lump or thickening in the breast or elsewhere in the body. While not all lumps are cancerous, it's essential to have any new or unusual lump checked by a medical professional to rule out the possibility of cancer. Breast cancer, for example, often presents as a lump or thickening in the breast or underarm area. But lumps can occur in other parts of the body as well. For instance, a lump in the testicles can be a sign of testicular cancer, while a lump in the neck could indicate lymphoma or thyroid cancer. Regardless of the characteristics, it's always best to err on the side of caution and have any new lump examined by a doctor. We've all experienced the discomfort of a sore throat, especially during cold and flu season. But when the feeling of something being stuck in your throat persists, or you experience pain or difficulty swallowing, it's crucial to take notice. This is what doctors call dysphagia, and it can be a sign of something more serious, including esophageal or throat cancer. If you find yourself struggling to swallow food or liquids, or if you experience pain that radiates to your back or ears, don't ignore it. Esophageal cancer in particular can cause a narrowing of the esophagus, making it difficult for food to pass through. Throat cancer can affect the pharynx or larynx, which are parts of your throat involved in swallowing and speech. If you experience difficulty swallowing that lasts for more than a few days, or if it's accompanied by other symptoms like weight loss, vomiting, or coughing up blood, see your doctor right away. We all experience indigestion from time to time, especially after a heavy meal or one too many slices of pizza. But what if that feeling of fullness, bloating, or burning in your chest becomes a regular occurrence? This is what we call persistent indigestion or dyspepsia. It can be a sign that something's not quite right with your digestive system. If you find yourself reaching for antacids more often than not, or if you experience frequent heartburn, nausea, or vomiting, it's time to pay attention to your gut. Pain is our body's way of telling us that something is wrong. While most pain is temporary and resolves on its own, persistent pain that lasts for weeks or months is a different story. This type of pain shouldn't be ignored, especially if it's severe or interferes with your daily life. Persistent pain can be a symptom of a wide range of conditions, from arthritis and injuries to infections and nerve damage. But it can also be a sign of cancer, especially if it's accompanied by other red flags like unexplained weight loss, fatigue, or changes in bowel or bladder habits. For instance, persistent back pain can be a symptom of bone cancer, pancreatic cancer, or multiple myeloma. If you experience persistent pain that lasts for more than a few weeks, or if it's severe, worsening, or accompanied by other concerning symptoms, see your doctor right away. So, there you have it, the top 10 early warning signs of cancer you should never ignore. Remember, knowledge is power, and by being aware of these signs and symptoms, you're taking a proactive step towards protecting your health. If you notice any of these signs, don't panic, but don't ignore them either. Early detection is key when it comes to cancer treatment, and the sooner you catch it, the better the chances of successful outcomes. Thanks for watching, and remember to stay informed, stay healthy, and don't ignore the warning signs.